On the occasion of World Heart Day, this month we are focusing on the importance of advancements in cardiac care. The burden of cardiac diseases in India is rapidly rising every year. In this context, it is pertinent to understand the latest treatment options in cardiac surgeries, from minimally invasive techniques to heart transplantation. Today, I have a very eminent panel of doctors to discuss this. I have with me Dr. Manoj Durairaj, consultant adult and pediatric cardiac surgeon at Marian Cardiac Center, Pune. Dr. Udgeath Dhir, he's senior director and head CVTS at Fortis Memorial Research Institute, Gurugram. We also have with us Dr. Sridhar. He's senior cardiac surgeon at Apollo Hospitals, Madurai. And also joining us is Dr. Sushan Mukhopadhyaya, Senior Consultant and Director, Cardiac Surgeon, Apollo Multispeciality Hospitals, Kolkata. A very warm welcome to you all on this show. So I would like to start with Dr. Mukhopadhyaya first. Sir, could you help us understand how minimally invasive CABG differs from traditional CABG and what benefits patients can expect out of it?
Of course, we all know for coronary heart disease, which India is one of the capitals of the world, multivessel coronary artery disease mostly affects patients' populations in India. This particular population of patients always benefit more from CABG surgery than other methods, non invasive methods, or catheter based techniques. But the fear of surgery often shifts these patients from the better treatment results to less apt treatments like catheterized treatments and all that. Now, with the advancement of coronary surgery techniques, we have been able to alleviate this fear a lot from the patient's minds. This is a traditional CABG which involved a bone cutting incision center of the chest. In minimally invasive, we make small holes at the side of the chest and go in and do the same procedure with the same quality and with much better results with early recovery and less patient problems. So, thus, it makes a huge difference in the outcomes in patients, and the patient's acceptance is also very high.
Dr. Dhir, I would like to focus on the minimally invasive part of this treatment. How does this part affect the patient experience on the whole?
See, I would say I do a quote. Right now, we are in an era of miniaturization. Everything we want is a small, right from our pen drives to even if we are calorie conscious, we want to taste a burger, but we want it on a fork. So that is how. And cardiac surgery was the last branch, I would say, because of the complexities to do the minimal invasive approach. So right now, with the help of, I call it not robotic surgery, I call it robot assisted cardiac surgery, in which we do multiple bypass surgeries as well as valve. And now with our latest advent, what we are doing right now in the era of minimal invasive is with a just previously we used to give a small incision on the anterior side of the thorax and we used to spread the ribs without cutting any bone and do it. Right now, from the axilla, we can operate cases like double valve replacement and with just, I would say, a 2 centimeter incision just around the nipple area, we can do mitral valve repairs and close certain heart holes. So we have advanced, and I would say the technology, the development of anesthesia, the development of other instruments, and making the surgery more safer. What I say right now is cardiac surgery is more safe than a gallbladder or a hernia surgery in the present scenario because we are monitoring so many things. So it's just by the name that you are going for undergoing a cardiac surgery doesn't make it high risk. We have now advanced so much, the pain is less, the blood requirement is less, the patient is early mobilized. Our patients are walking on day 5 with any approach they are discharged. It's a basic a myth that you undergo a cardiac surgery and you will be bedridden for 6 weeks. It's an old dictum. Patient is walking, get discharged on day 5. Day 2 he is walking and he can do normal activities except for lifting heavy weights. Rest he does everything. So I think we should propagate this that don't choose the second best option, choose the best option for your heart health. That is the dictum, that is the motto which we should follow.
Right. Um, when we talk about heart transplants, Dr. Manoj, it sounds a little daunting for anybody who would hear it or has to go through it. What kind of patients benefit in this context the most, in your opinion?
Thanks for this very good question. See, heart transplantation, right? You're absolutely right. It's very daunting because you replace the diseased heart with somebody else's heart. It's the biggest surgery somebody can undergo. And as you would know, heart is the only beating structure in the human body. So it is a daunting ask for a patient when you say, okay, heart transplantation is needed, but it is definitely needed for some patients, especially patients with end stage heart disease, when medicines or procedures like bypass or an angioplasty or pacemakers, these devices can no longer help. This is what we call advanced heart failure. And over the years, the indications which I have seen are children who have undergone open heart surgery for multiple congenital defects, which are complex. They come in their adult stage when they are 35, 45 with heart function of only 10 to 15%. So these are the patients who we need to offer heart transplant because they can have a very active life after that. Second is patients who have got problems with the heart muscle, what we call cardiomyopathy. That is important. And they are kids or they are adults, it affects both. And there's a other group which we call ischemic cardiomyopathy, where patients have repeated heart attacks, and because of the heart attack, the muscle gets irreversibly damaged. So whatever you do, nothing's going to help. And the heart function is so weak, 10 to 15%. Normal heart pumping is like this. But these patients come with hearts which are hardly moving and with repeated hospitalizations for end stage heart failure. And there are chances that they might die suddenly. After heart transplant, the survival rates are almost 95% at the end of 1 year. But without a heart transplant, the chances of dying are 95%. So when you can change the game with a heart transplant, it's a definitely good option for these patients. Not for all patients, but only for a selected group of patients.
Right. Um, Dr. Sridhar, I want to come to you next. Many patients who are on the verge of an open heart surgery, they fear a lot of things. Could you explain what does this procedure involves and what kind of patients benefit from this?
In fact, any patient who has got a very serious heart condition, like most commonly where in this panel which we are discussing is an advanced coronary artery disease, where the treatment, the patient is offered a lot of options of, say, catheter-based in treatments, which are commonly referred to as stents. Or the other option which he has is the surgery. And like our eminent speakers before, Dr. Sushant and Dr. Dhir have mentioned, surgery has a lot to offer than other treatment modalities because one, surgery is extremely safe, and two, the long-term benefits which accrue following this surgery is immense. And I think multiple studies the world over has consistently proven that a well-performed surgery is far superior to any of the other current modalities available at present. And the fear of surgery or the fear of pain alone is a very poor deterrent for patients' well-being. In fact, if I tell you surgery, as the panelists before have tried to mention, that they rehabilitate very fast, they're able to go back to their routines very quickly. And here, if I may mention a couple of very prominent figures in India, the two figures that come to my mind is one is Professor Manmohan Singh. He had a bypass surgery. That was the third time probably, and he was in his 80s. And he was then the sitting prime minister of the country. And I think within 3 weeks, he was back to work. And if you can tell me any post which is more stressful than a prime minister, I'll be willing to take a back seat. And
True.
the other political figure which comes to the mind very, very easily is Dr. N.T. Ramarao. I think if you go back in the past, he had at that time, some procedure was not very commonly done in India. He had gone to Houston in Texas, where he had had his bypass surgery. And in those days, it was a conventional surgery. It was not one of those surgeries which patients in India undergo, which is very, very advanced today. This I'm talking to you in the late 80s. He comes back from surgery from Houston. That must be just maybe a couple of weeks after his surgery. And then he finds that he has been ousted from the chief ministership of then Andhra Pradesh. From the airport, he rides his electoral van, which he called the Chaitanya Radham, and then he won the election for his newly established Telugu Desam party. That is the kind of activity which a guy can aspire to after a bypass surgery. There's a very, very short time frame. It's just a couple of weeks following surgery where these two very elderly gentlemen had to take on the most daunting tasks of their lives. So as patient, if he is a bit more discerning, if he does his research well, will have no fear coming in for arguably a very superior option available to him.
I think you've aptly described the procedure regarding some famous political personalities to give the right perspective. Thank you so much, Dr. Sridhar. Dr. Mukhopadhyaya, when we come and talk about recovery, how does this impact a common patient's life in today's context and in the context of the available treatments?
See, we are talking about minimal invasive cardiac surgery now, and majorly it has been adopted by very many surgeons in India, and most of the centers are doing it. That has made a huge impact in the outcomes of patients as regards to getting back to normal early after the surgery. The problems are less, and they tend to join back to their normal life early. So the man days lost is much less. Now, there are certain at every age group. This kind of a minimal access surgery has its impact. In a young patient, he or she gets back to his or her activity very soon, and there is a huge cosmetic benefit as well because the scar is not seen essentially. For a middle-aged active person, again, his work time is not lost very much, so he gets back to his productive days as soon as possible. And one of the other aspects are the very frail patients who deem they require surgery but are often were refused because of the harshness of the surgery, the big surgical impact which used to have in conventional surgery. Minimal invasive and robotic cardiac surgery has aided in getting them back to their normal life, whom they want to get in to their normal routine activities. And this is the area where we are talking about, and we have a huge number of patients beyond 85 years of age who had undergone surgical therapy through these methods and are leading very active life. Thus, I must say it has made a significant and a huge impact to improve their quality of life after surgery. Never to say that to allay the fear of surgery as well, that normal persons can get the treatment done, as rightly stated by Dr. Sridhar, if they do their homework well and lead a very effective and fruitful life after the surgery.
Right.
Thank
Dr. Dheer, when we talk about heart surgeries, the heart valves hold a very critical place. How is the type of valve decided, whether it's a mechanical valve or a biological valve? How do you decide that?
Okay, it's a very clear cut, I would say. At times there are gray zones, but most of the times we are point blank on what kind of valve requirement they should go for. The things which decide is what kind of lifestyle the patient wants. There are two types. One we call the mechanical valves or the metallic valves, and the other we call the tissue valves. The life of the mechanical valves is 25 or 25 years, but for the tissue valve, because of the degeneration and all that, maximum life may be for 20 years. So after 20 years, again in a tissue valve, they have to undergo some procedure. Mechanical valves we prefer in young patients who are aged less than 55 years of age, who can take regular medications, get their regular blood test done. But with the mechanical valves, there is a caveat that they have to avoid certain food contaminants, which are vitamin K antagonists, which can thicken their blood and there could be blood clots on those metallic valves. With tissue valves, you don't have to take blood thinners for long, for few duration ranging from 3 to 6 months, and after that you don't require any test. For pregnant females, despite being young, still we opt for the tissue valve where they can complete their family life. They can complete their family life, and then they can go for, once their family is completed, they can go for the other options. Right now, with the advancement, both the valves are appropriate, carefully selected. They let the patient lead a very good life. And with the newer valves which are there, even previously we used to give lot of blood thinners, and the blood thinning component which we measure by international normalized ratio used to be high. But with the present valves, even with mechanical valves which we are using, we can just keep that international normalized ratio low, despite and we will not have problems because of that, or clot formation, or the valve leaflets getting stuck up. So I can just share one thing. A 20-year-old doctor who was underwent wanted to go for a valve surgery. According to the normal dictum, he should go for a metallic valve. He said, I love football, and till 32, 33, I would love to play football, complete my medical schooling, and then go for a redo surgery with a metallic valve. That's the option for him. A 64-year-old, he says, I have no problem. I'll go for a metallic valve. I can diligently take that. So there are personal choices also. So we have to offer a palette to the patients, telling them, discussing with them thoroughly what are the pros and cons of various two kind of valves. The metallic valve has some, you have to listen to a tick tick voice. um, I have a patient whom I missed this, that you can have. The wife complained that at night I hear some voice in the chest. Have you left a watch inside, or is there something which is sticking in? So point is, you have to explain all these things to the patient. And once the counseling, what I say for any heart treatment, that is most important. And last but not the least, I would say, everyone was saying about surgery. Okay, I say one thing. Is there a word called medical strike? No. Whenever we have to tame someone, it's a surgical strike. It's not a medical strike. So once you have achieved such complex or advanced cardiac problem, so with that note, I would thank you.
A good point about the surgical strike, doctor. I want to talk about the post-heart transplant care. And Dr. Manoj, what does it involve for people who are viewing this discussion? How is it when they get operated post the heart transplant? What kind of care do they get these days?
Yeah, the surgery is just the beginning, and the preparation for the surgery actually starts much before the surgery itself. For a heart transplant, we have something called a donor and a recipient. The donor is normally a brain dead individual and who has a road traffic accident. They're younger individuals, so we need to select the hearts. And the recipient is a person with an end stage heart disease. So when we select the donor and the recipient, we need to match them properly, because you would realize this is a foreign organ which is coming into someone's body. So the own immune mechanism of the individual starts attacking that foreign body. And then that can cause destruction and even cause the heart to fail, even during the time or little later. So our matching of a donor and recipient is very crucial, which I'm very careful about my selection of the donor, so that the younger donor has less chance of a rejection. The hearts have to match in terms of the weight. So all this matters. And also there are some preformed antibodies in the recipient already formed. So we check all that so that there is no rejection. So it is a lifelong journey after the surgery, because the patient has to take immunosuppressive medications. Initially, there are around 5 or 6 medicines, but following 1 year, then the medicines only come to two. They are tacrolimus and a steroid. So lifelong, we take them only on two medicines. But what we do is we have a WhatsApp group which consists of myself, my anesthetist, infectious diseases, a transplant physician, and a cardiologist, and we closely watch our patient day to day. Even if they have a small red flag, we initiate the treatment immediately. I monitor them with regular biopsies of the heart muscle. Also, we have to ensure that they don't have any infection. So we ask them to, have some kind of social distancing. But over a period of time, that all settles. And any small procedures which they have to have, we ensure that it's done in a hospital. But saying that, if they remain disciplined in this care of the heart, the children can grow up normally, and young adults can resume their careers. People start going trekking or for hikes which they have never done before, and older patients can enjoy an active role in the family. So
Right.
definitely heart transplants, the results are really, really fantastic, much better than any other mechanical option which is available. And I would say if I have a survival of 95% plus in 1 year with a 3% attrition rate every year, I would take that option for end stage heart disease.
Great. Um, After heart transplant, I want to discuss the open heart surgery. Dr. Sridhar, if you could come in and tell us, how does open heart surgery affect long-term heart health?
See, you got to understand the basic idea of any treatment is to make the person better off than what he is currently today. Whether it's a simple headache for which you take a Crocin or an aspirin and then you're back to work once the pain subsides, the same thing applies to the heart. He has a problem which cannot be treated very effectively with, say, medication or with other devices. So that is the time he is referred to surgery, whether it's a hole in the heart, whether it's a deformed valve, whether it is a blockage in his arteries, or whether it's a failing heart which needs a transplant. All of them have one basic goal of putting the patient right back on his own 2 feet. So I will say heart surgery is, if that is the best option for you, that is going to make you better off than what you are today. And you should be able to get back to practically whatever you wanted to do. There is absolutely no question on this ground. There is no need to fear that you will in some way be a diminished individual after a cardiac surgery. Because you just imagine yourself, if you're not able to walk more than 10 steps, you're able to breathe with difficulty, you're not able to go to the toilet on your own because your heart is not able to function in a way which you're normally used to, the surgical treatment will set you back onto a near normal course. So heart surgery, when it is recommended, and if that is the ideal treatment for you, is the best or probably the only option available to the patient at that point in time. And I think there should be no hesitation whatsoever. In fact, I have to tell you some statistics. If a patient undergoes a bypass surgery, say over 60 years of age, it has been statistically been proven that these individuals live longer than a contemporary who has not had a surgery. That is, we actually prolong life, which very few treatment options actually can claim credit for. Of course, this is not applicable to all patients. This applies to a definitive subset of patients, but this is the power of an appropriate treatment.
I think that's a sunny side up, that the life tenure increases in some patients. What are the other long-term benefits that patients enjoy after minimally invasive heart valve replacement, Dr. Dheer?
So it's not about, see, minimal invasive, I would say, I just started my note on that. It's the new, I would say, the showstopper right now.
Yeah.
Okay. So everyone wants minimal invasive, everyone wants everything. So it's right now, but the advantage, I would say, one is cosmetic, as our panelists we discussed. For a young female who has to get married, there is a scar, just a small scar, 2 centimeter scar in the axilla, no big scar on the chest. See, we live in Indian society, we have to, why I started more of MICS, that was the reason. The rheumatic valve patients coming and we were giving big scars, and right now I just give a 2 centimeter scar in the axilla and her valve is replaced. No one makes out that she has a scar. She feels more confident. So it's not just alone surgery alone. It gives you psychological benefit also, the cosmetic benefit also. And last but not the least, suppose 25 years down the line, she again requires a treatment. We have another path. We have not blocked the main path. We have another route to it. So that also makes our life easy. So it is a futuristic approach. It's not just tackling the situation cross sectional. It gives you futuristic approach also. And I would say, I would agree with Dr. Sridhar as well. It is not about lifespan. It is about a productive, psychologically, physically active, and a confident patient, which impacts more than a patient. I would say, Sylvester, there are lot many whom we followed as whether it is Sylvester Stallone, whether it's Arnold, all have undergone heart surgeries, and they are proud of those. They are proud of that. Right now, with that minimal invasive approach, they have an option that they feel, yes, we underwent a treatment. Like I would say, previously open gallbladder surgery used to be done. Right now, no open gallbladder surgeries are done. It's mostly lap with a small hole. We are also doing the same thing. And once treated, there are certain diseases. I would say patients, they don't come for follow up. They are treated for life. So that is the game spirit. We don't want regular follow ups. That is what I say. In surgery, we treat once and then we shut it and forget it for next 10, 15 years. If you are following your regular lifestyle, you don't need most of the patients. I tell you, regular basis, I would say among all the panelists, there are patients whom we operated 7 years. After 7 years, they are coming. Oh, we were coming to this place and there was some marriage. So that's why we wanted, okay, we should show. I don't have any problem. So we have good subset of patients with these approach also. Tell me which other modality, which other treatment offers that. And still, I would say heart surgery is the most condemned one because everyone says your chest will open. I would say we have a collaboration with the Japanese and all that. There is a subset of segment in Japan where they say that if the incision is on the chest, your soul is lost. Okay, so we have to, with the, I would say, appropriate education, and I would say educate the population, choose the right option. You never choose. You have a 42 size shirt size and that color is not matching and you have a 44. We never pick up 44 size shirt because it doesn't fit. But we don't choose. We want to eat the best food and the restaurant, there is a waiting list. We wait for half an hour. But for cardiac, we say no. We are going to choose the second best option. Why? Why compromise on that? Because we have not educated. There are so many myths. You won't be able to walk, you will have a big scar. For men, I would say there are certain patients whom we offer, we have to do open heart and they have. I say only men and warriors have scars on their chest. So we have to motivate the patient. So it is about proper training and spreading the right information.
I
I
think
would say that is most important.
yes, I think making a patient confident post surgery, post operation is one of the key things that the recovery should aim at. Dr. Manoj, how have advances in contemporary technology and surgical techniques improved the outcomes now?
So my specialty is heart transplant, so I'll be just talking on that. When we look at the advances in technology, there are a lot of preservation solutions because we need to take the heart from one individual, transport it within a fixed period of time, and ensure that it's beating in another individual. So, as I said, heart is the only beating structure of the body, so we need to stop it. And when we need to stop it, we have to give some solutions to it. And now with advanced solution, which was not there many, many years back, we're able to preserve the heart for a longer period of time. We have also transport systems where we can actually keep the heart beating while we are transporting them, so that the duration of ischemia, what we call, can be sort of minimized. So there are a lot of technological advances which help us from taking out the heart from one city maybe, and going to another city. And then we can do different techniques which we have standardized, which minimize the time of a heart transplant, minimize. And also, which what plays an important role is modern immunosuppressive therapy. They're really, really advanced. Not like the days when they started heart transplants, people were getting lost because of treatment problems, medication, which are not available. Now we have fantastic immunosuppressive therapy, and we've hardly seen any rejections of that, the heart which we transplanted. So all of this actually improves the quality of life, survival for our patients, and patients who are considered very high risk before, like multiple surgeries or severely damaged hearts. We can take them up with ease now. We've lost the fear of doing complex surgery. And we also have something called an ECMO, like you must have heard it during the COVID time, to preserve the lung. So we also use an ECMO to preserve the heart nowadays. So in case there's an issue, we can always put the patient on a mechanical support for before the procedure or after the procedure. So all this has advanced technologies and has contributed to our results and outcomes.
Right. Now let's talk about the lifestyle changes or lifestyle measures that a heart patient should follow after the surgery. Dr. Sridhar, your thoughts on the same?
Yeah, but before that, let me just take up on what Dr. Durairaj was talking on, the advances which you said. I will give you a brief times line. See, my dad got operated in 1984 at Chennai Apollo. And at that time, it was a bypass surgery, and the facilities in Delhi were not considered good enough. And so we flew down to Chennai. And the package, which my fellow panelists will agree, in those days in 84 was 3 weeks, 21 days. And I'm sure my colleagues will be aghast because today we are able to discharge our patients on the 5th day or the 6th day. So this is the advance which these patients are now expected to, because from 21 days in the 1980s and 1990s, it has now been brought to 6 or 7 days. And that shows that the improvements are all incremental on multiple parameters, but the end result is the patient goes home quicker. And
Right.
it's also very, very safe. And
Right.
then, so this is the first part of the question. The second part is, of course, the lifestyle modifications. Okay. So here we will break up the lifestyle into two parts, in the sense what affects the lifestyle in the future, as say compared to a patient taking medications or a patient undergoing very minimally invasive procedures like a stent. In a stent, there is no cutting. There's just a small hole in the thigh. So a surgery, we may do minimally invasive or a conventional surgery. So the patient has to undergo that little extra burden of healing of that injury also. If the patient's heart is well preserved, he can go back to an absolutely normal lifestyle, like after he undergoes a stent or anything else. So, but we have to give some time for the healing of the wound in the chest. With a minimally invasive, he can go back a lot quicker than a conventional surgery. But even with a conventional surgery, within 2 months, patients have been known to take up competitive marathoning. I'm not talking that this is for an average individual, but the encouragement for an average individual is he can go back to practically everything which he wanted to do, provided his heart is in a good condition. If the heart is a very weak heart, that will be a limiting feature, whether he undergoes surgery, whether he undergoes minimally invasive surgery, whether he undergoes stenting, or whether he's just on medications. So whether he can go back to his completely normal lifestyle depends only on the condition of the heart. If the heart is in a good condition, he can go back and do practically anything. He can go back to competitive weightlifting within a year. He can go back to swimming. And as I told you, competitive marathon running within 2 months of surgery has been achieved by people who are really committed. And to give an example of, again, a celebrity like Arnold Schwarzenegger. He's undergone 2 surgeries and he's able to lift weights, which an average fit individual can even not dream of. So there is absolutely no limit based on the surgery. It is only the nature of the heart that determines your activity.
Right. I think you told us a little about the quality of life that changes, but I want to talk more about this with Dr. Durairaj. What changes have you seen amongst your patients, Dr. Manoj, in the quality of life after recovery?
Uh, See what's happened for a heart transplant or a patient with end-stage heart disease. As Dr. Sridhar and all my fellow panelists have said, these patients are quite sick with a poor heart function. They are very breathless. They can't even go to the washroom, and they retain a lot of fluids in the body because the heart can't beat and the urination doesn't happen. So there's a lot of retention of water, and these patients are getting admitted repeatedly. Post transplants, I'll just share two examples with you. There was one forensic medicine professor. He had to actually resign from his job because he was not able to, in fact, teach, in fact, even talk. Post transplant, that gentleman was walking up 5 stairs, even more active than the students, and he got the Best Teacher Award. This is a medical college in Pune, and that is a national kind of Best Teacher Award which he got. So imagine from a patient, from a person who can resign a job because of his heart ailment, now getting back to normal activities. It's a huge change. We have young kids who have had transplants. Now they have passed their 12th and they're looking forward to fantastic careers. We have farmers who have, are breathless short of this thing. Now they are active breadwinners. So I think there's a dramatic change. And as Dr. Sridhar said, it matters on the quality of the heart. If the quality of the heart is great for an individual, and especially with a surgical approach like what we are discussing, I think it's a dramatic improvement for the patient as well as the family and for society at large.
Great. Uh, Lastly, Dr. Sridhar, if you could tell us about how, as a doctor, you make a decision between different surgical procedures or techniques to be adopted.
See, today we have a lot of tools at our disposal. We now understand these diseases extremely well, and we have also, in many ways, mathematically quantified the severity of the disease. Like, for instance, it's a coronary bypass surgery, or before that surgery, the patient has got the blockages in the artery. We can actually measure the amount of blocks and we assign a number. So, and that is a different scoring. So we will say if the syntax score is say 20 or something, which is a very low score. For instance, for instance, we assume you have no heart problems, your score will read 0, correct?
Right.
But a patient with some blockages will have some number. So we say up to the number 20 or 25, by and large, the patient can be a good candidate for a stenting or a surgery. But if it goes beyond that, the outcomes favor surgery more than a stent. But end of the day, I think like Dr. Dhir mentioned, it is talking to the patient that is very important. What is his lifestyle? What is his aspiration? What is his stage in life? If it's an elderly gentleman, we would rather not subject him to a very major surgery if he's got a lot of comorbidities, if he's very frail, he has got other problems, he's got a kidney failure, then we may say, yes, we can offer you, say, a stent or put you on medications for some time. So, but these are all things that we have to take in consideration with the patient, the severity of the disease, consult with your cardiology colleagues, and then also we know what is the risk involved with surgery, for which again there is a scoring system. So we then discuss all these things with the patient. We say your risk is very high or your risk is low, your benefits are likely to be high, so we would recommend surgery. Or because of these reasons, we may say that it is better in your individual case, looking at your lifestyle, looking at your necessities, treatment B may be better. So today it's quite simple. All you need is a good intent. I think the intent is good. The decision becomes very easy. You consult with your cardiology colleagues, you discuss with the patients, and then you plan a treatment.
Dr. Mukhopadhyay, for patients, heart patients who are, yet to make up their mind on what kind of treatments
Yes.
they would go ahead with, what you would like to say to them on the occasion of World Heart Day?
Oh, yeah, that should be a very clear message to patients who want to get treated for their heart. It's time to make up their mind and take a decision. Why do you want to fear? You have to have a very good lifestyle. Enjoy it, because treatment options are so well available nowadays, with very high quality recent advances, that makes the patients absolutely having a very good lifestyle after surgery, and early on after that too, so that they can pursue their careers, their whatever job they have to do. They have to fear less about their other problems about open heart surgery or whatever it is, cosmesis and everything. So don't have any fear. Please go ahead, get yourself treated, and have a very good life ahead.
Thank you so much for giving us a very good overview of the advanced technologies today and clearing a lot of misconceptions around it. That how does recovery take place, and how patients can look forward to a normal lifestyle if they follow certain rules and get better with their heart. Thank you so much for sharing your precious time with us at Times of India. It was a pleasure having you all, and I'm sure our viewers must have had a lot of insights about the modern advancements in heart care. Thank you so much.